Thank you very much. Patient-reported outcome measures, or PROMs, have become an integral part of orthopaedic practice, be it as part of a research study, routine cohort or departmental follow-up, or increasingly as an adjunct communication aid. They've become an essential tool for elucidating the effects of our treatments. Where range of motion or strength can be measured objectively, musculoskeletal PROMs measure unobservable constructs, such as pain, functional or psychological well-being. In psychometric science, these are known as latent traits. The PROMs you will be familiar with, such as the Oxford scores or the EQ5D, have been designed using classical test theory. Here the latent trait is estimated through the summation of the whole questionnaire, with no weighting or different questions or responses. The development of mathematical psychometric science has brought with it the ability to derive much greater detail from PROMs responses. Item response theory is a method that looks at the difficulty and discrimination value of each question and each response option. Through the analysis of large datasets of legacy measures, such as the Oxford scores, much greater levels of information can be derived from PROMs, and the latent trait can be estimated with greater accuracy. IRT also creates new possibilities in administration, namely computerized adaptive testing, where algorithms take the response to a question, then pick the next most appropriate question in sequence, stopping when the latent trait can be estimated within a predefined level of precision. It may be that administration of the entire questionnaire is not required, as information from further questions becomes redundant. With this in mind, we aim to assess if this approach could be used for the Oxford hip and knee scores. We use the NHS Digital National PROMs programme dataset. We extracted the 2018-19 dataset, which consisted of over 40,000 pre-op hip and knee scores. We were looking only at primary arthroplasty. First, we assessed if the Oxford scores conform to IRT assumptions, and we then fit a graded response IRT model. Following the development of the model, we simulated the efficiency of the computerized adaptive test using the 2017-18 dataset. We used preset standard error of measurement parameters that equated to precision of 80% and 90%. The Oxford hip score was found to be unidimensional and conformed to the IRT assumptions. Its marginal reliability, which assesses the overall reliability of a test, was excellent. What you see on the right is the item parameter curves that are plotted for each response option of each question. When we ran the computerized adaptive test, we found that at 90% precision we only needed 3 questions to accurately predict the latent trait. At 80% precision, this reduced to a median of 2. The question deriving the most amount of information in differentiating patients was question 8. The OKS also fit the model well. For the cat, we only required 4 questions at 90% precision and 2 questions at 80% precision, with questions 9 and 10 selected by the algorithm as conferring the most discriminating power. Here you see the number of questions needed for the participants in the 2 OHS simulations. You can see that the large majority of simulations only required a few questions. Similarly, for the OKS, the amount of questions required to accurately estimate the latent trait was minimal. This study has shown that with application of modern psychometric techniques, you can reduce the questionnaire length by up to 82%. If one extrapolates the average amount of time required by participants to complete these scores, at the National PROMs programme level, this could equate to over 30,000 hours of reduced data collection. This is the first analysis of its kind in hip and knee arthroplasty, and shows the profound ability of computerized adaptive testing to reduce patient and institutional burden. It may also improve compliance, as patients only have a handful of questions to answer. This improved compliance in turn improves the completeness and usability of the entire dataset. Thank you for listening.